So what are your feelings about that? Because I saw that one of the questions, you sent for the AI said that just because we can doesn't mean we should. But right now you just gave me an example where you said, you had to get onto that technology bandwagon. So how do you feel about a similar thing which is now applying to AI?
So our short-term initiative right now, and we're getting
Hmm.
to the ambient generative AI,
Yes.
and we have physicians that are willing to, but we're taking our time. And that's
Hmm.
what I guess start small and don't rush. Sort of like we did with the
Yes.
online scheduling. That was sort of one of the factors that we had to make sure we didn't do is rush
Okay.
through this and try to go big bang. Also, we had to make sure it works with our current EHR. What has been great for us and has worked over the multiple years I've been here is we were able to customize and program our EHR to our specific specialities, which I know a lot of large organizations, this you try to, I won't say put everybody in a mold. We're trying to create that mold specific for our orthopedics and plastics and now pain and et cetera divisions, which is just
Okay.
basically a preformed or custom fabricated splint. So that's
Mhm.
where we're treating this. So yeah, so the nice thing with the company that we're sort of doing a pilot with, I don't want to say them out loud, so we haven't really signed a contract yet, does work really well and sort of puts the output of the ambient AI into specific, we'll call it observation terms or fields in our EHR. So it's just another means of getting the data into our EHR and our custom programming.
Okay. So this
Uh,
is during the patient consultation?
this is during yep, the patient's in here and as they're speaking, just like all the other ambient AIs, it just create a note, but then it sort
Yes.
of segments them off into different areas because this is the HPI. So we're going to put this in the HPI section. Here's their health history, far as surgery goes, and past medical problems. We'll move that into this section.
Mhm.
Some of the other social fields, and then of course the assessment and plan. Those are going to its own section. So it's sort of taking that ambient AI generated text and then
Yes.
we on the back end are assigning it as they send it to us to
Mhm.
a specific field. So it's almost like having a scribe sitting there typing
Right.
this into but it's just sitting there ambiently and doing it. And what's nice about what we have in our current system, which is Athena practice, it's all structured data. So if we want to report on this, I could throw into a SQL query and pull it all out. Well, that's the
Right.
beauty of it. Instead of just having a note that a searchable PDF or what have you, it's still sort of structured data. You can still find information, but to really extract it out and run analytics on it,
Right.
that's where we're at now and what we're looking forward to. It's a nice, easy transition. I do know
Mhm.
some of the providers who are using scribes are excited about it. One, because the scribe is not a permanent role. It's sort of a
Mhm.
transitional role. I just graduated undergrad. I'm waiting to see if I get into med school, and they're taking this role and they want to get into orthopedics and it just looks good on their resume. And then you don't have, well, this came up or I'm sick and they call off, and now I have nobody. So this is
Right.
sort of a nicety and replacing a human being in the room and listening and doing all the describing for the provider. So I think they're excited. They see how it works. And with the company we're going with, they've been known to be able to control the EHR via voice as well.
Okay.
So it's a nice blend of the two.